Good morning, everyone. It is really an honor for me to be here with such a distinguished list of speakers. And I have some very exciting news to share with you. First, let me tell you about myself. I became fascinated with brain and neuroplasticity when I was 6 years old. I was in Iran, and my father said, Majid, there's no end in the capacity of your brain. You can do anything you wish you could do. And he told me about the story of a young girl who had lost both of her arms in an accident. And she had learned to paint with holding brushes in between her toes. And he showed me the pictures. He said, would you be able to do these paintings with your toes if I told you now? And I said, well, I don't think so. And then he said, that's the point. Your brain has the capacity to grow, and it's endless. And so I became fascinated. I said, gosh, I'm going to study the brain. This is interesting. And I did. I went on to get a PhD in neuroscience and MD, residency in neurology. And I was always fascinated by neuroplasticity, how our brain has the capacity, an innate capacity to grow, to recover from concussion, to recover from stroke. But then 3 or 4 years ago, a whole new revolution happened. And I became totally, even more fascinated than I was before. I learned that the capacity to grow, the neuroplasticity that can happen in our brain, is not just at a molecular level. It is at a level that we can see with naked eyes on a brain MRI. You can grow your biceps. You know that, right? You can grow your brain to the point you can see with naked eye. And that's the point I decided, that's it. I'm going to start a program and bring these research findings into a clinical practice. And I totally agree with Linda. We can prevent Alzheimer's disease. In fact, we should stop calling it Alzheimer's, because by calling it Alzheimer's, we're saying this is a hopeless situation. And most people have many causes for their cognitive decline. And in the next 20 minutes, I'm going to share with you the latest science that shows we can indeed prevent cognitive decline with aging. We can all have a better brain next year than we do this year. All of you can have a better brain next year than you do this year. And I'm going to tell you the science behind it so that you will be convinced, and you yourselves will be motivated and excited to do something for your own brains. Are you interested? Okay, let's do it. The information I share with you, I have published in 2 Nature articles. One is called Modifiable Factors That Alter the Size of the Hippocampus, and the other one is Changing Perspectives Regarding Late-Life Dementia. I have also published these in books, and I have shared this information with public through lots of media interviews. So these are the main things I'm going to cover today. What happens to our brain with aging? Can we reverse age-related brain atrophy? And then can we put a program that would change our brain and grow it larger? A little bit of Brain 101 for people who don't know neuroscience in here. So this is an overview of the brain. The outer layer of the brain is called cortex. You can think of a bowl on top of 2 bananas. The bowl is a cortex, and the bananas are hippocampus. Hippocampus is critical for the ability to obtain information and consolidate it for long-term storage. So let me ask you to do a little exercise. I want you to all think of the house you lived in when you were in elementary school. Do you see it? So I want you to think of the kitchen. Do you see it? Isn't that incredible? Isn't this beautiful? It's been like 5 or 10 years. Okay, 10 years for some of you, 15 years. But it's beautiful that we can see events in the past. And then you all remember what happened in your wedding, and 9/11, major events. The things that were stored for long-term memory are thanks to hippocampus. Now, it's called hippocampus because it kind of looks like a seahorse. It's a hippocampus, and it's a seahorse. Hippocampus in Greek means seahorse. And if you slice hippocampus from here and look under the microscope, you see this beautiful row of neurons. You see them? These are you. because we are, to a large extent, our memories. A lot of what makes us act and feel and experience life has to do with our previous experiences, and those are stored thanks to the hippocampus. Now, there's some good news about hippocampus and some bad news. Which one do you want to hear first? Bad news. Okay, I'll hear the bad news first. The bad news is that with aging, hippocampus shrinks by about 0.5% per year after age 40. It was 50 last year, but there's a recent article showing it actually starts in 40. And this is the reason that memory lapses become more frequent after age 40. Then the question becomes, why? Are we all getting Alzheimer's disease? The answer is that there are many reasons for your brain to shrink, and especially your hippocampus. Hippocampus is unique in the brain in that it has the highest amount of malleability. It shrinks easily and it grows easily. And I've spent much of my research studying these things, and I've learned that sleep issues, vascular issues, stress, anxiety, depression issues, and concussion issues, as well as Alzheimer's, can all contribute to the shrinkage in the hippocampus. And so if somebody has memory problems, has cognitive aging in their 60s, they should not be thinking of Alzheimer's. They should be thinking that these other things may play a role. Is there evidence for this? I'm just showing you some examples of the evidence how these things shrink your brain. Depression. This is duration of depression. This is the volume of hippocampus. The longer time you spend being depressed, the smaller your hippocampus gets. So if you worry about getting Alzheimer's, you're actually contributing to getting it. Stress, anxiety are terrible for the brain, especially hippocampus. The bigger the belly, the smaller hippocampus. These are people with big belly, small hippocampus, good, normal, not fat, and high-sized hippocampus. So the factors below your neck have an important role on what happens to your brain above your neck. Here's another example of stress and size of hippocampus. This is the size of hippocampus. This is cortisol levels. The higher cortisol level, the smaller hippocampus. This is insomnia. The longer period of time you spend having difficulty sleeping, the smaller hippocampus gets. And there are literally hundreds of these studies. When I reviewed these things, I wrote a book about these things in 2002. And since then, there have been literally hundreds of studies showing that many factors literally shrink your hippocampus, and Alzheimer's is one of them. One of the biggest factors is concussion. And that's why a lot of NFL players end up getting, quote-unquote, Alzheimer's disease. So what if you have 4, 5, 7, or 8 of these? Well, the more risk factors you have, the smaller your brain would get, and especially your hippocampus would be particularly smaller. Now, this was the bad news. The good news is that a lot of factors can reverse this shrinkage and make it bigger. And now I'd like to spend some time telling you how we can change this balance in our favor. So the question we're going to answer is, can we reverse the age-related brain atrophy, especially in the hippocampus? I'm going to show you 5 or 6 examples of things that have been shown scientifically through prospective studies. Increased size of hippocampus, not cross-sectional studies, prospective, somewhat controlled studies, randomized studies. Here are some examples. The best thing for you to grow your hippocampus is to exercise. And this study showed that if you walk 45 minutes 4 days a week, you will grow the size of your hippocampus. There were 2 groups of people in this study, those who walked 4 times a week and those who did stretching exercises 4 times a week. The blue line shows what happened to the hippocampus of those who just walked 4 times a week. Their hippocampus grew larger by 2%, which is equivalent of having a brain that's 4 years younger. And the group that didn't exercise, did stretching exercises, experienced shrinkage in their hippocampus. So it's not that stretching shrinks the brain, it's that these people didn't exercise. And on average, your hippocampus shrinks, on average. Another factor is vigorous exercise for a short period of time. That was over a 1-year period. So here I want you to participate in this part. I want you to look at A, and I want you to look at C. This is one person before and after 3 months of exercise. especially on a stationary bike, exercise on a stationary bike. Look at A and look at C. Which one is bigger? This is the hippocampus outlined in blue. A and C. Which one is bigger? You need to come closer. This is a study that showed exercise can grow the size of your hippocampus within 3 months to the point that you can see with naked eye. And in that study, which was one of the reasons I decided to start my own brain center, published in 2010, showed that everybody who exercised grew the size of his or her hippocampus. And another factor is diet. People who have omega-3 fatty acids can grow the size of their brain and have better memory. Another factor is learning. This shows that the more you learn, the bigger your hippocampus gets. This was a study in medical students. Another factor that can help with growing not just hippocampus, but other areas of the brain is neurofeedback, a technology that improves your brain activity through feedback. And here's an example of that study that shows this area in red are areas that grow in volume when patients receive neurofeedback. Treatment of medical conditions such as sleep apnea can also grow the size of the hippocampus. Look at this here. This is before. This is after 3 months of treatment for sleep apnea with CPAP. And the yellow areas are areas of hippocampus that grew in size. Again, the growth, the neuroplasticity is at the macroscopic level, not a microscopic level. Meditation. Meditation can grow the size of your hippocampus. Now, so many things make it smaller, but if you meditate regularly, you will see that the areas of hippocampus can grow. So when is the best time to work on growing your hippocampus? When you were a kid. These are my daughters. It's my lovely wife. And my little girls can tell you all the things that grow your hippocampus and all the things that shrink your we were one day driving by McDonald's in a road, and there was no other restaurant, and I said, I know we don't go there, let's make an exception. They said, Dad, they would not go there. And they tell me how I should watch out my sugar levels and everything else. So, knowing all these things, I decided to put together a program that combines everything. If multiple negative risk factors shrink your hippocampus by a lot, and multiple positive factors can grow your hippocampus by a lot, why don't we just take care of patients and provide a program that would do all of that intensely within a short period of time? And I did a program for 3 months. The program involves seeing me, getting some tests, going through the program, and then doing a follow-up MRI. And the first thing I do a head-to-toe evaluation for all the factors that can affect the brain: depression, anxiety, insomnia, everything, snoring. Then we do a set of tests that include fitness testing. I want my patients to improve their fitness. I do MRIs, cognitive testing, we do brain mapping, EEG, we do cardiac ultrasound, blood tests, and sleep studies as needed. So if somebody doesn't have sleep problems, they won't get a sleep study. Then we provide them with a personalized set of interventions. As a neurologist, I take care of the medical problems, and my team provides 3 sets of interventions: brain coaching and counseling, which involves training our patients to do meditation, cognitive skills training, both by computers and hands-on games, and we do neurofeedback. The other thing we do is we monitor our patients on a weekly basis, and we tell them, you will get better next week. Why? Because everybody else does. You can't be the exception. Because you're 80 years old, that's no excuse. We have lots of people who are 80 years old who memorize 100 things, and we get our patients excited. Instead of saying, oh, you have Alzheimer's, I'm sorry, you're going to die, we say, look, you can grow your brain. We get them excited, and we get them involved in growing the brain. So this is one of our patients who came to me to confirm a diagnosis of Alzheimer's. She was 69 years old, watching TV all the time, was confused, wasn't doing anything, wasn't talking much. And her sister wanted to sell her house so that they can put her in a nursing home. And when I reviewed her medical history, it was terrible. Sleep apnea, untreated depression, multiple medications for pain, which would make him further sedated, a lack of activity. And I fixed all of those, put her in a program, and within 3 months, Her memory improved, her attention improved, concentration improved, mood, anxiety, sleep, everything improved. And this is one of our patients, but it's not the sole patients. 84% of our patients in the study that we did on 127 patients with MCI improved significantly. MCI is a condition between normal and Alzheimer's disease. And our patients, 84% of them improved in at least 3 areas of cognitive function. We also did MRIs, and we found that indeed the brains of our patients does grow within 3 months. This is that patient I told you about. This was before, and this is after. And again, you don't have to be a neuroradiologist to see this is significantly bigger. In fact, it was 8.6% bigger, which means her brain was a brain of someone who was 17 years younger. And in reality, that's how she acted. She came all like a little old lady, even though she was 69. And within the program, as she was going through the program, she perked up. She started dressing better. She joined the gym. And by the end of the program, she was coming in a gym outfit with a nice bag on her shoulder. And I loved it. I loved it. And then we monitored her. So she did the program. She was a totally new person. She started 5 new hobbies. She started looking for a job again. And her life was totally turned around. And all I did was something that every doctor in this country should be doing. We should treat memory loss the same way we treat patients who have chest pain. We have to have a differential diagnosis and treat them. Imagine the situation where patients go to a doctor with chest pain. They say, oh, you have a heart attack. Go to the angio room. We're going to treat you with heart attack medications. No, we listen to them. We'd have a list of 5 or 7 things, and we treat them. And fortunately, right now, this is not what our doctors do. This is not what our neurologists do. But there is strong evidence that these things work. And I'm confident that 10 years from now, what I'm doing would be standard practice. It makes common sense. This is not rocket science. It is fairly straightforward. And the science behind it is very compelling. It's not just 1 or 2 cross-sectional studies. There are plenty of controlled studies that show we can grow our brain. And by the way, the amount of growth in the brain in this patient was not just this patient. We looked at all our patients. A third of them continue to grow, continue to have shrinkage in their brain. It may have been less shrinkage than it would have been otherwise. 12% did not change, which is a good thing because normally it does shrink. But 53% had increase in the size of their hippocampus. And this is really remarkable. I think this is really the future of medicine and neurology. That patient I told you about came back a year later. So this was the amount of growth in her brain, 8.6% in the hippocampal volume. A year later, without being a part of our program, her hippocampus volume stayed the same. And we've done that in more and more of our patients. Now we see that. The increase in the hippocampus volume is sustained in part because people change their lifestyle. When they know that these things shrink their brain, they have an extra incentive not to do it. If you see a donut, and that donut is going to shrink your hippocampus, you will think twice, don't you? Sometimes my sister has a strong opinion and tells me what to do with my children and what to do for Christmas. And she's 6 years younger than me, but she feels like she's my mother. And she has very strong opinion about things. And I say to her, darling, Sister Mariam, I love you. I'm not going to ruin my hippocampus for you. I think we have to realize that our hippocampus is precious. And every day we have an opportunity to erode it. And every day we have the opportunity to grow it. It is in your hands which way you do it. Thank you. I can take a couple of questions. You can go to the microphone. You're asking.
2 quick questions. The first is, why do you think walking is better than stretching? And the second question was, when you showed the people that went through your program and a medium percentage, their hippocampus got smaller, some stayed the same, what do you think was the difference between the 3 groups?
Yes, good question. Difference between walking and stretching. It's not that stretching is not good. is that you need to do something to increase your VO2 max. You need to do things that increase your fitness. You should be able to go up 10 flights of stairs. You should be fit. So if you can do a lot of stretching to the point that you can get fit, or if you do weight training that you get fit, that's okay. The best relationship, there's a linear relationship between fitness and the size of the hippocampus. And the second question is, why did some patients grow their hippocampus and others didn't? The answer is that everybody's hippocampus, on average, shrinks. That's the fact of life, on average. So if it shrinks by 0.5% and you reduce it to 0.2%, it's still a shrinkage, even though it's less bad than it would have been otherwise. And also, different people have different intensity of participation in the program. Those who are really motivated do much better. The thing we do, and I think the secret to our success, is that we set the bar high. My father told me, Majid, I want you to learn 7 languages, get an MD and a PhD. And I said, Father, come on. And I did. And I think that's one thing I learned from my father. You set the bar high, and you foster, you encourage, positive encouragement. You ask people, what do you feel passionate in life? What excites you? And a lot of people say grandchildren. And you say, don't you love to play brain games with your grandchildren and win? You can. Let me help you.
Hi.
Yes.
How do you measure hippocampal volumes, and aren't there different methodologies that need to be compared to make sure that the data that you're seeing is actually accurate?
Yes. So the question is, how do you measure the size of the hippocampus? There's a new FDA-approved technology called a NeuroQuant that has a measure of plus or minus 0.5% accuracy on MRIs over time. And so there's a new company called NeuroReader, and these have shown that they have validity in measurements to have accuracy.
Thank you.
Thank you very much.